Yeah.
And we are live, Senators.
All right, so this is Senate Health and Welfare. We're back on February 3rd, and this is Mental Health Advocacy Day. Actually, I think it's all week, isn't it?
It's all week.
Yeah, so it's great. And Monday was a big day for folks. Welcome.
Thank you.
We're going to introduce ourselves to you first, and then we're going to ask you to introduce yourself for the record and talk with us about Team 2.
Okay.
So, Senator Gulick.
Hi, I am Senator Gulick from Burlington, and I represent Chittenden Central.
Excellent.
Good morning. I'm from Proctor and I represent Rutland County.
You said your
What's your name?
Oh, Dave Weeks. I'm a little scrambled this morning, so trying to find out
Ginny Lyons from Chittenden Southeast.
Terry Williams, Rutland County from Pope.
Good morning, Ruth Hardy, Senator from the Addison District.
I'm Kristen Chandler, and I'm the coordinator of Team 2, which is a training program here in Vermont that I'm going to tell you about. Senator Lyons, I really appreciated your talk on Monday at Mental Health Advocacy Day, the
Thank you.
intro. I am here as part of Mental Health Advocacy Week. It seemed like we needed to fit this information just about what training police get in Vermont around mental health issues, because I'm involved in all of that. And so just very briefly, I'm going to tell you about that. So you're aware of it.
And we do have Margie LeMay behind you, ready to speak. So whenever, and we're going to go until about 25 after.
Okay.
How's that?
I think I have about 10 minutes.
That's perfect.
So in Vermont, what certified police officers receive that's required is 8 hours of mental health training. It's called Interacting with Persons with a Mental Illness. It's taught at the police academy by myself, police officer, and a mental health clinician. And that's what they get. That's required by law. And then what's optional is after that, they can take Team 2, which is what I run, which has been in existence now for 10 years. My background is I was an assistant attorney general here for 8 years with the Department of Mental Health. Prior to that, I was the staff attorney at the state police. Prior to that, I was a prosecutor for 10 years in King County. And for the last 10 years, I've been running Team 2 and teaching at Norwich as an adjunct. Team 2, it's a collaboration between the Department of Mental Health and the Department of Public Safety. It's a grant that's funded or run by Vermont Care Partners. And it's statewide training that is offered in 5 different regions around the state for mental health crisis clinicians, law enforcement officers, EMTs, dispatchers, emergency department personnel are invited, state's attorneys are invited. Sometimes DCF is there in the room. It's great to have their perspective. And it's 1 day of scenario-based training where all those first responders come together and work through scenarios. They hear about the updates in the law from me. They hear from somebody with lived experience, and they hear about the resources that are available in their particular region. And that's why it's regional, is because the resources are so very different depending on where you are in a state. It's not mandatory, it's totally voluntary, and the last few years I've had waiting lists really at most of the trainings. The state police did make Team 2 mandatory for all their troopers about 4 years ago when Captain Scott was there. He recognized it as really valuable to have additional mental health training. So I work with the state police to get all of their troopers through the training in those locations every year. And then I want to make sure you know also there is there's an effort right now I'm part of that's a CIT pilot training. So CIT is crisis intervention training, which you may have heard of because it's sort of the gold standard in the country for police mental health training. It's a 40-hour training, and it's based out of Memphis, started in Memphis, Tennessee. It's really designed for major metropolitan areas. And 10 years ago, we created Team 2 sort of as an answer to the CIT training because we recognize that here in Vermont, it's really hard for police departments to send people to a 5-day training. And so Team 2 is sort of the answer to that, where we're really condensing that information into 1 day, because that is what police departments can send people to. And while Team 2 is voluntary, I will say, I keep a list that's required by the grant. There's probably only 6 or 7 police agencies who have never attended Team 2, and those are the really, really tiny ones. They only have 1 or 2 officers. So there is a CIT pilot project going on right now in Washington County that has been going on for a couple of years. We're actually rolling out the training in March. That will be 5 days. We have turning point people, EMTs, police officers, a dispatcher, and some mental health folks currently signed up for it. But what we're finding out, which is kind of what we already knew, is that it's really hard for people to attend 5 days of training that we're asking them to. And so we only have about 10 people signed up right now. But we're going to hold the training, and that also is scenario based, and it also involves one of those 5 days involves site visits where the group will go around and look and get to see like the emergency department, psychiatric unit. They'll go to Turning Point. They'll go to some other agencies that we think it's important for them to see. The Vermont State Police does also, they've added in the last 3 or 4 years a pre-basic training for their officers that I've conducted, and now Morning Fox is doing it, and also a post-basic training. So Vermont State Police has really, on their own, recognized the need for additional mental health training for their troopers. So they're getting 3 hours ahead before they even start the academy. Before they get any of the law, they just get an overview of the mental health system in Vermont. And then once they're finished the 16-week academy, they then get an afternoon of role playing where Fox brings in an actor. I've done it in the past. I brought in an actor, and the troopers have to go through a scenario and talk somebody down, basically, and provide feedback. One of the things that I just want to put a bee in your bonnet about that I hope will be coming in the future is a bill that will require refresher training for law enforcement on mental health cases. And this, I gotta tell you, it didn't really occur to me until a couple years ago, I was helping a friend move into Boston University, and there was an officer standing around outside dealing with and stuff, and I just chatted him up. There were a few of us who were prosecutors talking about him. And I started asking about his mental health training. He told me, yeah, we have to do 44 hours every year. And I was like, geez, you know,
44?
Four every
Phew.
year. And he started talking about how helpful it was and how they, you know, we do have mandatory training for all the other tools on their belt, tasers, you know, firearms, domestic violence stuff that is required, but we never require here in Vermont any follow-up. And I have people, officers in my Team 2 training who've been officers for 20 years. And, you know, stuff changes, things change, and the whole culture has changed really on how we respond to mental health cases. So I have a student of mine at Norwich who's also an intern at the Montpelier PD. So he did some research for me and found that there are 17 states that require some follow-up mental health training. I provided that to you in my written testimony, what those hours are.
Would you be willing to send us your testimony in writing? So
I did. I did.
Oh, we have
You
it,
have
okay.
it, yeah.
Oh, I'm sorry.
So that's fine. It varies from like 1 hour every year up to 4 hours
Yeah,
every year.
okay.
Or it may be like 3 hours every 3 years. It depends on the state.
Okay.
And I've talked to a lot of officers because I thought I'd get resistance on this, and they're all like, no, please, we would welcome this. We would really welcome this because.
And it's at the state level. Is it at the state level?
Yeah.
For those other states?
Yes, it is. Yeah.
Yeah, because so much of what we do, it happens at more of a local level.
Correct. Yeah.
Okay.
But again, I think it would probably need to be regional because of those
Yeah,
resource
definitely.
differences. Yeah.
At least regional.
Yeah. So any questions?
So we have this testimony and we have your expertise. And so this committee will be talking mental health issues, maybe not directly to a bill, but it will sort of directly to a bill, but this might be something that we can consider and recommend. There's a cost to it, but it is a worthy cost. So stay connected with us.
You bet. You
Yeah,
bet.
that'd be great.
I just had a quick comment. Thank you very much, first of all. I haven't seen this bill, but I'm very excited. My husband's an airline pilot. Every 9 months, he goes to a training that's quite intensive. As a high school teacher, I had professional development every year. And we throw the word crisis around a lot, mental health crisis. What that says to me is we have to do things differently. We cannot do things the way we've been doing them. And this will be huge because we have so much evidence of what happens when police officers and folks in a crisis collide, and it's often doesn't end well. So I'm really excited about this, and I look forward to learning more.
Good. Well, this is the other thing. I just came from a meeting where we were talking about this, and I want to send you every year I publish a little thing called the Team 2 Training News about the good outcomes in Vermont, because you don't hear about those good outcomes.
No.
You only hear about the negative ones. And there's so many, there's a lot of really good work going on. And in fact, I've been able to take Team 2 to some international conferences and talk about what we're doing here for training. No other state is doing it this way, with people in the room together at the same time and building those relationships that are necessary. And I'll tell you, there's really just some great work going on. I also serve as the vice chair on the Mental Health Crisis Review Commission, and where we review cases, and we're still seeing that there's really good work going on.
That would be really helpful to get some of that information. I live in Burlington, and the narrative is
So it's a different narrative.
it needs some work. So thank you. That'd be great. Yeah.
So I'm gonna, this is terrific, and I think what we might do is invite you back another time when we're ready to put something in writing.
Happy to come back.
That would be terrific.
And I really would like to hear Marge, so I'm just gonna.
I want to be respectful of Marge's.
Yeah.
She has to sit outside.
Yeah.
Margie's
on the streets.
Cold though.
It must, I'm gonna say, you look like you're very warm for this day. And
Yeah, I'm being held by a very close friend by her scarf.
can you introduce yourself for the record and then let us, give us some information about NAMI? Thank you for being here.
Yes, certainly. Good morning. It's a privilege for me to be here today. I'm very grateful for the opportunity, so thank you. My name's Margie LeMay. My family has lived in Colchester, Vermont for the past 30 plus years. I'm a member, a volunteer, and an employee of NAMI Vermont, the National Alliance on Mental Illness of Vermont, part of America's largest grassroots mental health organization. Before I begin with my testimony, I would like to share something with you that I received from my daughter-in-law as a text. And it will make sense to you when I read you my testimony. She writes, when you've spent decades carrying a heavy weight and it suddenly implodes into nothing, your body, so accustomed to holding, is shocked by the weightlessness. Your arms have atrophied in a now empty hug. Your feet are unsteady on flat ground. Your sense of time slips and twists back and forth and back. Oh, your spinning mind, there isn't anywhere to a light that is firm and real. You are suspended from above by a thread while the world whirls around you. Faces and voices, kind words and touches from loved ones flow past you. And when they go, there is quiet, deep and smooth, yet buzzing with absence. The terrible moment you wake in the morning and remember the possibility, the loss of possibility for him, the finality of it. Today, my family's story is one of failed systems, struggles, heartache, and profound love. Today, I'm talking about our son, our family, but there's hundreds of others in Vermont who are in one stage or another of crisis. No action can help my son now, but we can change their outcome. Today, I would like to share with you my 31-year-old son's journey on this earth. We lost him less than 2 weeks ago on Monday, January 23rd, 2023 to a lifetime of struggle with mental health and more recently addiction. Everyone who loves him is both devastated by this loss and comforted to know that his struggle and his pain in this life is now over. I'm here to tell you that at every turn in his and our journey, every social system designed to help us failed us. The mental health system, the physical health care system, the education system, law enforcement and court systems, and our social service systems, every one of them underfunded, understaffed, overwhelmed, and stretched beyond their limits, were never able to function smoothly in a coordinated, efficient way to pool their resources and offer our family the right care at the right time and in the right place. The result is that the baby boy we welcomed into our life on October 11th, 1991, with incredible joy and hope, is no longer with us. The NAMI Smarts training program that I co-teach with Laurie Emerson, NAMI Vermont's executive director, teaches people how to write an effective, concise story, deliver it to you, the legislators, and most importantly, make an ask. I have given a lot of thought to what my ask is today. The systems designed to fix the problems are causing them. My ask is for everybody listening right now, whether you identify as a peer, a family member, or community member, a provider, or a legislator. Please feel and adopt my urgency and help me fix what's broken. We need to start over and design a system where we communicate, coordinate, and make efficient use of our extremely limited resources. Our systems must be generously staffed with people who are paid well, who have a workload that allows them to focus on providing whole person care from start to finish, supporting and guiding their clients until they are well into recovery. As a society, we must step up, stop talking, and start doing. How is it possible that my son could drive to City Hall Park and within minutes be approached by a half dozen dealers all vying to sell him fentanyl? Because the police are so disrespected and reviled that no one wants the job, and far too many positions remain unfilled. How is it possible that my son could be transported by ambulance after a near fatal overdose last fall and then be released within an hour with no one having encouraged or offered a rehab placement or any kind of follow-up care? Because he was physically stable. There's no placement for them to offer, and there are 24 people in the ER waiting to be seen. How is it possible that the only way we as parents could get him into a residential placement as a young teenager was to give up our parental rights and allow him to be placed in a foster home until a placement became available? Because the only placement in Vermont at that time was funded by the state of Vermont and was reserved exclusively for teenagers in the custody of the Department of Social Services. It's important for me to note and you to know that we had private insurance at the time that would have paid 100% of the cost without time limits. My husband and I, and everyone who loves our son, is just now beginning to learn how to exist in this world without our brilliant, funny, compassionate son. Because despite investing every ounce of courage and resolve we had, all of our resources, and the love and support of many family and friends, the systems designed to help us failed us every step of the way. I implore you to help me fix this now, before we lose one more person we love. Again, today I'm talking about my son, my family. Hundreds of our neighbors, friends, and loved ones are in the same cycle of crisis right now. Help me change their outcome. I don't want to hear one more person say, I'm so sorry for your loss. I want to hear them say, I hear you. I see you. I feel your pain. How can I help you fix this, what's broken? Thank you for listening. I very much appreciate this opportunity, and I hope to have additional opportunities.
Thank you very much, Margie. We do hear you, and your testimony is on our webpage. It's very compelling, and you have offered some suggestions for improvement to the system. We greatly appreciate the work that you're doing. And we also, in spite of what you said, send condolences about your loss. So thank you. And unfortunately, we're going to have to go offline at this time, and we look forward to staying in touch with you as well. So thank you.
Thank you very much.
Thanks.
Thank you.
Alex, we're offline.